Hi everyone, I hope you guys are keeping well. In this video, I'm going to talk about meniscus injury, which is a very common knee injury that you see in many individuals. We're going to cover a couple of things in this video that we're going to go through, such as what is the cause of the injury, what are the type of the meniscus injury, what is the management basically option for it, and how we can diagnose this condition. If you've never been in this channel, my name is Bob. I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update, and don't forget to press that like button. Let's get started. We're going to start with the cause of meniscus injury, which is a turn meniscus can result from any type of activity that cause you to forcefully twist or rotate your knee, such as aggressive pivoting or sudden stop and turns. It's very common in basketball, and many basketball players could actually face with this injury. What are the symptoms that after you're getting a meniscus injury that you may face? It would be pretty much similar to any other type of knee injury. Pain in the knee, stiffness and swelling would be very common in acute phase. Catching or locking of your knee, it's a very common symptoms of actually meniscus injury. The sensation of your knee that giving way, which means you might not be able to lock your knee, and you're not able to move your knee through its full range of motion, which means get kind of like stuck and locked in some stage in your knee movement would be most common meniscus symptoms. The types of meniscus injury, it depends on this basically intensity or severity of your injury, and they are categorized based on the shape of the tear. In some cases can be horizontal tear, there might be a radial tear, some cases it might call a longitudinal tear, and we have flap tear, and we have bucket handle tear, which would be a severe cases. We do have a degenerative tear, which would be most commonly happen due to aging, and is very common in most individuals. In regards to diagnosis of meniscus tear, an MRI scan is the most accurate and non-invasive test to confirm a meniscus tear in comparison to ultrasound scan. In addition, X-ray do not show a meniscus tear. If you do have a sensation of actually you got a meniscus tear, please do not get X-ray because it's not going to show in the imaging. However, not everyone needs an MRI scan after a meniscus tear. After your initial consultation with your physical therapy, you may basically send for an MRI scan based on the severity of injury and your signs and symptoms, and your physical therapist will be able to help you with that. In regards to treatment and management of meniscus tear, many things does influence the treatment, such as age of the patient, activity level, and also the size and location of the meniscus tear. In this video, I'm going to share with you a conservative management in acute phase, which is a series of exercises that you can do by yourself with minimum equipment for your basically recovery. I would recommend all of my patients and people who watch this video to consult their physical therapist before trying these exercises.
The first exercise that we are going to try in this routine is going to be knee extension with the help of a towel rolled at the back of the knee, and you're going to hold in that position for 3 to 5 seconds. While you're doing this exercise, you're activating your quadriceps muscle and trying to push down to the towel and hold it for 3 to 5 seconds. You can practice this exercise for 3 sets of 8 to 10 repetitions. We're going to move on to active knee flexion with the help of towel, and as you can see, I'm trying to adjust the towel underneath of the heel of my foot and try to, with the help of towel, get more smoother movement. You're going to try this exercise for 3 sets of 8 to 10 repetitions, and your focus is on the range of movements. If you find that movement is a bit restricted, you could use a resistance band or a normal band or even a belt to assist your knee flexion. As you can see, I'm trying to slowly move my knee and flex my knee with the help of that resistance band. You're going to go through a comfortable range of movements and try this exercise for 3 sets of 8 to 10 repetitions. The following movement that I'm going to show you in this exercise routine is going to be hip flexion. in a seated position, and you're going to partially flex your hip. You're going to practice this exercise for 3 sets of 8 to 10 repetitions. You can gradually increase the range of hip flexion. The following exercise that I'm going to show you guys is going to be active hip extension that I'm using my own body weight. And in this exercise, we're trying to practice this move for 3 sets of 8 to 10 repetitions. You're going to move on to knee flexion in a prone position, and you're going to try this exercise for 3 sets of 8 to 10 within the range that it feels comfortable. We're going to progress this exercise routine to body weight, partial calf raises. As you can see, I'm using a wall for balance, and I'm going to do the basically partial range of my calf raises. This exercise can be done for 3 sets of 8 to 10 repetitions in this phase of your rehab routine. And gradually, you can progress it to the full range with the use of basically stairs or step at home. You can gradually get the full range of movements and progress this routine for 3 sets of 8 to 12 repetitions. The last exercise that I'm going to share with you guys in this routine is going to be partial wall squat, which in this part of your rehab, you spend a good amount of time in the first few exercises that I share with you in this routine, and you have a good control of your knee, which means you can walk comfortable and the swelling is down. And you're going to practice this exercise for 3 sets of 5 in a partial range of wall squat and gradually progress it to a deeper range.
I hope you guys find this video helpful. If you have any question regarding meniscus injury or knee injury, leave me a comment and I will definitely get back to you. If you need further assistance, you can always book an online consultation with me and we can go through a customized plan for your recovery. Make sure to connect with me in my social media, in my Instagram and my Facebook basically account. I'll leave a link below. And if you have any further assistance, you can always contact me through my social media. Make sure to subscribe to my channel for my weekly update and don't forget to press that like button. Until next week, all the best.